How do you interpret CFTR gene mutation reports? Interpreting a CFTR gene mutation report can seem complex at first, but understanding the key elements helps clarify what the results mean. When you receive a report, it usually includes details like the mutations found, the laboratory methods used, and the clinical significance of those mutations. The report starts with basic information such as the patient's name, date of birth, and why the test was ordered, whether for diagnosis, carrier screening, or prenatal purposes. It also describes the testing technique and which mutations were included in the panel. The core part lists the mutations or variants detected and explains their potential impact on the CFTR protein, which is responsible for cystic fibrosis. Mutations in the CFTR gene are classified into different types. Pathogenic mutations are those known to cause cystic fibrosis, often because they lead to significant changes like premature stop signals, faulty splicing, or amino acid substitutions that impair the protein's function. If someone has two copies of these pathogenic mutations, it usually confirms a diagnosis of cystic fibrosis. Variants of uncertain significance are mutations whose effects are not yet clear, so they requiring cautious interpretation and sometimes additional testing or family studies. Some mutations may cause a wide range of symptoms, from classic cystic fibrosis to milder or atypical forms, especially when combined with specific genetic factors like the R117H mutation paired with certain poly-T variants. Benign variants are common in the general population and do not affect the protein or cause disease. The context of testing is crucial. If the test was done to diagnose someone with symptoms, finding two pathogenic mutations supports the diagnosis, but doctors will also consider other tests like sweat chloride levels. For carrier screening, detecting one pathogenic mutation means the person is a carrier, which is important for family planning. If no mutations are found, it does not entirely rule out carrier status because the mutation panel might not include every possible mutation, especially in diverse populations. For prenatal testing, results help assess the risk of the fetus having cystic fibrosis and guide reproductive choices. It's important to remember that not all CFTR mutations are fully understood. Many have unknown effects, and the presence of a mutation does not always predict how severe the disease will be. The genotype provides valuable information, but it must be combined with clinical evaluation and functional tests like sweat chloride measurements. Genetic counseling is highly recommended to help interpret the results, explain the implications, and discuss options for further testing or management. Reports often include guidance on variants with variable effects and variants of uncertain significance, especially in diagnostic contexts, but may limit reporting of these in carrier screening unless relevant to the partner's status. When reviewing a CFTR mutation report, start by confirming which mutations are present and how they are classified. Check whether the mutations are heterozygous or homozygous, and whether they are in cis or trans configuration, if that information is available. Consider the patient's symptoms and other diagnostic results to get a full picture. Remember that a single mutation or no mutations at all does not eliminate the possibility of carrier status or disease risk due to limitations in testing panels. Use the interpretation and recommendations provided in the report to guide clinical decisions and family counseling. Ultimately, understanding CFTR mutation reports involves integrating genetic data with clinical findings, following established guidelines, and consulting healthcare professionals for personalized advice. This approach ensures that patients and families receive accurate, balanced information to make informed choices about their health.